Perritt, maybe we start with you here on who will be the most impacted if this is scaled back, while Roe v. Wade is really overturned.
Thank you so much for inviting me. That's a really important question and something that I think is critical for us to talk about. The reality is that people with means and resources have always and will always have access to abortion care. But communities who are marginalized from care more broadly and abortion care specifically, so communities of color, young people, LGBTQ folks, undocumented communities, those who are living on low incomes are really going to feel the brunt of these restrictions.
You know, Congresswoman, I look at a tweet that you had recently about the leaked SCOTUS opinion will set women's rights back generations. Black women and those living in rural areas will be the worst impacted. I'm wondering if you could also drill in on this and what you're hearing from these communities that might be the most impacted.
Well, the reason I said that is these are the communities that struggle with access to health care right now. So this will just exacerbate the problems that they already have. I mean, the people that I'm hearing from, they're sad, they're hurt, they're disgusted, they're frustrated. They can't believe that we're going to turn back the clock. And as the doctor said, that people that are privileged, they've always had access. It's other people that will not have the access, which they've been used to having for 50 years now.
How do we see this already playing out, Dr. Perritt? There are still so many states now where there are big gaps in access to clinics. And what can we learn from those areas in terms of how the women are impacted and what they need to do to find care?
There's so much to learn here. You know, all of the questions, especially in the last 24 hours about the fall of Roe and living in a post-Roe America, doesn't recognize the fact that there are lots of places in this country where people can't get access right now. So we can look at states like Texas, Mississippi, Alabama, Arizona, where folks are struggling to access care, even though abortion is legal in those states. And so looking at what happens to health outcomes for folks that are seeking abortion care and are unable to obtain them, the evidence is really clear. We have a lot of robust evidence, especially from the Turnaway study, that looks at long-term outcomes for individuals who are seeking abortion care and denied it. So we're talking about economic impacts. We're talking about mental health impacts. We're talking about impacts on our health and well-being for generations to come. It hits individuals, families, and entire communities hard.
Some of those impacts, I'm wondering, Doctor, if you can drill into them a little more. How do those impacts play out, especially from a health and mental health perspective?
So what we know is that for individuals who are seeking abortion care and then subsequently denied it, who are forced to carry a pregnancy to term, they have a more difficult time finishing school, so lower educational attainment, lower job prospects. We know that folks are more likely to be tied to abusers if they're in in a relationship that has violence going on. Folks who are denied abortion care when they have sought it are also more likely to report depression and mental health effects. And so these effects are long term. I think it's also important that we connect this to maternal morbidity and mortality. So when we're looking at the outcomes in many of these same states that are restricting access to abortion care, we see huge inequities in maternal health, especially for Black women and birthing people.
Congresswoman, you know, if you look at how many people traveled to Illinois alone in 2020 to seek abortion access, to seek a clinic, to seek health care, it was about 10,000 people alone. So I'm wondering what this looks like, you know, for you and the people around you, and in terms of traveling across state lines to get care.
Well, the mayor of Chicago and the governor have already said that we have seen an uptick already, and we expect to see more women coming to Illinois. But of course, everybody can't afford, unfortunately, to make the trip if they want to have an abortion. But we expect, Planned Parenthood reported that we are already having an uptick and they expect more women to come, but also they're welcoming more women to come, and we will be prepared to service those women.
To your point, I'm wondering, and maybe you can bring back some of your career before you were a congressman as well, and to Congresswoman as well, to give us some perspective here about what it means for the women who can't travel, for the women who are in states that they are in more restrictive areas.
Well, women feel stuck, first of all, and the doctor brought up maternal mortality. I've done a lot of work around that. And, you know, we expect to see more of that. And also you see more of it right now in states that the doctor named. I'll talk about Mississippi. They have the most unplanned pregnancies. They're high in maternal mortality and actually infant mortality also. And then they don't have access to healthcare or payment that some of the other states have. So I frankly see things getting worse. I see, unfortunately, women dying more because of this lack of access, lack of being able to travel. Everyone just cannot afford it or cannot take off work.
You know, I'm wondering, Jamila, I'm wondering what you think about alternative access. For the women who are seeking alternative access, for the people who are not able to travel, what concerns might you have, and what advice might you have for people who are stuck in a really tough situation moving forward?
I think there are a couple important things to flag here. One, abortion has always and will always happen, whether it's legal or not. And so what we want to make sure is that folks are able to access this care safely. There are more people that cannot travel than people who can. And even for those who can travel, when you look at states like Ohio and Chicago, right, in Illinois, then we know that those clinics, those healthcare centers that Planned Parenthood, the independent clinics, are completely booked and backed up. So folks who are living in that state where abortion is accessible for them also cannot get care and then are forced to travel. So there really is a trickle down effect. When we look at and talk about access to abortion care outside the formal medical system, because I think that that's what you're asking. If you can't get care and still need an abortion, what can you do? What should you do? One, we know that folks will access this care and care for themselves in the best way that they know how. And sometimes that means managing one's own abortion. And the good news on that front, if there is good news, is that with the advent of abortion pills specifically, people are able to access these medications, sometimes through alternative routes outside the medical system, and can have their abortions safely. From a medical standpoint, the risk here is not a medical risk, but a legal risk, because people are arrested, prosecuted, jailed, taken from their families and communities for managing their own abortion. And so it's important for us to talk about the risks of criminalization for folks that are accessing any care outside the medical system, including abortion care.
I want to also take a look at this interview that had happened yesterday with Elizabeth Warren, with Senator Warren, and just to show how divisive exactly this country has become.
This is what the Republicans have been working toward this day for decades. They have been out there plotting, carefully cultivating these Supreme Court justices so they could have a majority on the bench who would accomplish something that the majority of Americans do not want. 69% of people across this country, red states and blue states, old people and young people, want Roe versus Wade to maintain.
We don't want to dismember children in the womb.
So I'm wondering here, Representative Kelly, when you talk to people in the Republican Party, when you talk to people who don't agree with you, what is the conversation looking now? How tense is it, and how might it play out into the midterm season?
Well, actually, we're recessed from Washington, D.C., so I haven't really spoken to any of my colleagues, but everyone is not anti-choice on the other side, but it just seems like they don't speak up about it. But no, it's going to be a battle. But also that's why it's so important that people vote in every election. It can't just be that you vote in the presidential election. You have to vote in the midterm too, because that's what has allowed some of this to happen. Some people to get elected that are not pro-choice. So we, the public, have to take responsibility too and vote in every election. But I expect, many of them to be cheering. But as you see, Lisa Murkowski and Susan Collins are not cheering. It seems like they were, if I could say, bamboozled into voting for some of those justices.